sexy. Thank you so much for joining me again today. I'm Dr. Limor, your friendly sex and relationship counselor and therapist. This is Anti-Aging Sensuality. I'm so glad you're here. And today I want to touch a topic that has been brought up to me a few times about interest in this topic, which I'm going to mention in a second. So I decided to do a whole video about it because it's very relevant and it's a very special way or manner to kind of manage any pain or discomfort, whether it is physical or emotional. And what I'm talking about is EFT, Emotional Freedom Technique, or otherwise known as tapping. This technique is very useful, it's very easy to learn. After you kind of apply it and you learn how to use it, you can do it anywhere by yourself, any place or anywhere you are, and it can be discreet. You can do it and you can manage it, you can use it and utilize it to your advantage anywhere. And what I love particularly about it is once I teach a patient how to use it, they can use it themselves. They don't need the instructional maneuver of a therapist. They can actually use this technique on their own and to manage pretty much anything and everything. So EFT is using essentially our energetic body, and what it does is by tapping, and I'm going to show you where and how, by using the tapping technique, we're actually breaking, short circuiting the connection between any pain or discomfort and its physical manifestation. So what we do is we cut the cord by using this, and we restore the bioenergetic balance of the body by tapping on certain energy meridians all through, I would say all through the body, but all through the upper part of the body essentially. These energetic healing meridians are actually very relevant to treat anything. It doesn't have to do, a lot of people assume that we tap a certain area that is painful, but that's not how it works. You tap meridians that actually allow healing via acupressure in a way. And of course, it doesn't have to be a very intense tapping. It can be a very mild one, and I'll show you in a second how it's done. I'll show you one session of tapping. Usually what we do is we start with evaluating how a certain pain, discomfort, thought, troubling thought, a belief, something that bothers us on a scale of 0 to 10, where it stands before we start the treatment. And then after 3 sessions, usually is done as a beginning, we examine it again. And then we see if there's a change, if there's something that has been moved and has advanced. And then if there is still something that bothers us, we repeat it or change a little the way it's done. And I'm gonna get to it in a second. But the idea is to essentially get to 0, to the place where this pain, discomfort, belief, anything doesn't really bother us. It just stays there somewhere, or we get completely rid of it, and we are able to continue with our lives and just live comfortably. So I want to mention that the combination of tapping, which I'll show you in a second how we tap, and a positive statement, and it's very imperative to kind of create a positive statement that is suitable for what we're looking for, and I'll give you an example in a second. But what is important about that statement is that it's going to be verbalized in a positive way and not a negative. In other words, we're not going to say, I don't want this, but I'd rather have this. So we're trying not to use don't, not, get rid of, things like that. There are more of a negative tone that are related to negative, there's a sense of a negative tone to them. So when should we use it? We should use it upon rising or when going to bed. Obviously, we can use it all through the day. It's a very reassuring tool to use, and you can use it, as I said, anywhere. Once you learn to use it quietly and peacefully and without even being noticed that you're doing it, and you'll see that it's possible once I show you how it's done. You can do it anywhere and everywhere, and as many times as you would like during the day. But the rising and going to bed periods are very important because we're focused, we're more kind of in a meditative kind of place emotionally, and that will help our to cut the cord between the physical manifestation and the energetic body. So that will help if we do it during these times. Another thing to keep in mind is to stay hydrated while we're doing this, because uh, water carries electricity, and the energy healing is very kind of relying on the electricity in our body. We are an electromagnetic field, all of us, all of it. So essentially, it's very important to stay hydrated regardless of it, but this will help in the result that we can achieve from the tapping. Um, what else did I want to say about this? The most important thing is to keep in mind that the therapist is not healing the patient. Once you teach the patient, or once you teach yourself how to use it, you're the only healer of yourself. There's no one that you kind of rely on to help you manage this, and you can really advance it. You can really find new ways to kind of implement this into your life and create a very helpful and very specific healing to any problem that you have, and kind of advance it to other problems once you kind of solve a situation or discomfort. You are ready to let go of it and move to something else that bothers you. And obviously, we are surrounded by many things that bother us, and so we can treat them one by one. I suggest to stay focused on one thing at a time, to kind of not lose interest, or to kind of not lose focus on what we're trying to achieve. So that's kind of like these are the kind of guidelines to tapping, and let's jump right into the practice. So how it's done and where we tap. So let's just start with the affirmations. So the positive statement that I'm going to say, for instance, and I'm using myself as an example for this. So I suffer from chronic migraines. So I would want to say, I am feeling clear headed, I feel good, I feel positive, I feel healthy, my head is clear, I feel lifted and clear minded. Rather than saying, I don't want this headache, I don't want this headache in my life, it's bothersome, I don't want it, I want to get rid of it. So the don't is not really suitable. And that's the first part of the positive statement. So I'm saying, I feel clear headed, I am enjoying my life, and I have a very positive and healthy life. That's the positive statement that I want to say. Now there is another way to kind of verbalize our request, and that will say that will use two parts of that's a version of two parts, and that version will use again my example. That version will go like this: even though I have a headache, even though I have a migraine, I completely and fully accept myself. So you can use either this statement or this two-part statement. I would suggest to start with the more kind of structured statement, which is two-parted, and then move, once you are graduating from this and you are more advanced, you can use only the clear-headed and, or the positive part that is only single part. Just because it will create kind of like a process that you're used to, and you are more able to control the wording and everything around it. So let's just say I'm using this statement that I said: even though I have a migraine, I completely and fully accept myself. Later on, you can shorten it by using certain parts of the statement and not use the whole statement. So let's just start with how it's done. The meridians. So we're starting with this part of the head of the hand. We're going to tap on this part, and this is the first meridian that we're touching, and we're going to end with it as well. So how is it done? I'm personally using two fingers and doing this. I'm saying the statement and tapping at the same time. So even though I have a migraine, I fully and completely accept myself. Even though I have this pain in my head, I fully and completely accept myself. You can do it a few times. Then we move to the other area, which is the head. So again, 2 fingers, you can kind of support your head, and you'll go, even though I have this migraine, I fully and completely accept myself. Even though I have this discomfort in my head, I fully and completely accept myself. Okay, now we're moving to the third meridian that we're going to tap, and this is over the eyes. So this area here, and of course, as I said, don't tap hard, just enough. You can essentially even touch the air, but because it's an energetic healing, but you should touch it if you can above your eyes. You can do it with one hand, you can do it with both. Doesn't really matter. Let's do it with one so you can see me better. So even though I have a migraine, I fully and completely accept myself. And you can continue tapping until you feel satisfied. The next point in meridian is here, right next to the eye. So I'm gonna move my hair so you can see. So I'm tapping right here and I go. Even though I have this migraine, I fully and completely accept myself. The next meridian is under the eye, and again, even though I have this migraine, I fully and completely accept myself. The next one is under the nose, so in the area between the lips and the nose. Here, even though I have this migraine, I completely and fully accept myself. Next point, right here, on the chin, under the lip. Even though I have this migraine, I fully and completely accept myself. The next specific meridian is under the collarbone, around here. You can again use both hands or one. Even though I have this migraine, I fully and completely accept myself. The next point is on the side of the body, right here. So, tapping, even though I have this migraine, I completely and fully accept myself. Like alongside the chest. And another meridian that sometimes is used and sometimes isn't. It's not necessarily crucial, but you can use it if you're a beginner to try to cover everything. And it's right under the chest. So here, I'm tapping here. Even though I have this migraine, I fully and completely accept myself. Okay? And the last one, before we go back to the head, is this here on the wrist. So even though I have this migraine, I fully and completely accept myself. And you can use either side, you can rotate, and then this finishes a first one. And then we can begin with this, or this can be only in the beginning, only in the first session we can begin with this, and then we move to the head. We did 2 points. So let's do one all together so you can follow along and implement, obviously, your specific statement. So, even though I have this migraine, I fully and completely accept myself. And I'm going to cut it short, so pay attention. Migraine, I fully and completely accept myself. You can use all the hands, all the fingers, or just 2. Have this migraine, I fully and completely accept myself. Migraine, I fully and completely accept myself. Migraine, I fully and completely accept myself. Migraine, I accept myself. Migraine, I accept myself. Migraine, accept myself. Migraine, I accept myself. Migraine, I accept myself. Migraine, I accept myself. Okay, so this kind of finalizes one session. I suggest to repeat 3 times the whole session This in the beginning of the first one, then head, eyes, all over the face, collarbone, side, under the chest, and wrist. So you do this whole thing 3 times and you examine how you feel. So for instance, I felt that the migraine was very bothersome to me, and I kind of scaled it on between 0 and 10. I scaled it on 8. After 3 sessions, I examine and see if I went down to 4. If I did, I can stop there, or I can alternatively continue all the way to 0. Maybe it will completely eliminate the pain. Now, this doesn't have to be while I have a migraine attack. Usually it's more difficult while I have it. But if I want to manage the idea of having these attacks on a regular basis, and that the fact that I'm suffering from this, and that I suffer from chronic issue that bothers me, I'm going to conduct these sessions on a regular basis daily until I feel uh, um, some change in the way I feel, or the attacks are not as strong, or the occurrence of it is much slower or much softer, or I don't come across this pain so often. So any change in this can really tell you that you're doing a great job. And I suggest to really take it slowly and try to, kind of advance and shift into it. In time, you're going to become an expert in kind of structuring the positive statements that you use and the way you use this tapping. So, for instance, if I'm sitting in public and I want to do a session, I can say quietly within myself without voicing it. I can say, migraine, trust myself, completely accept myself. Migraine, accept myself, without voicing it out loud. And I can do the tapping very quietly. I can do it like this, I can do it like this. Nobody can notice that I'm doing this, and I can do it. So this can be done anywhere, any place. Hopefully this helps you. I'm very glad that you guys asked about this, and I'm very hopeful that it will help you in any discomfort or any pain that you're using, that you're dealing with in your life. And until then, stay sexy and subscribe. I'll see you very soon. Thank you for all your questions. Come visit me again next week. Bye bye.